Welcome to Harder-Mehl Dental Clinic. My name is Sönke Harder and today I'm going to talk about wisdom teeth. The adult human dentition consists of 28 teeth. If we add the wisdom teeth to the dentition, we count 32 teeth. Normally, the cutting of the wisdom teeth occurs with 18 up to 21 years. In absence of the cutting process, we call it a retained or anchored wisdom tooth. What kind of reasons do we have now for the necessity of the extraction of wisdom teeth which are already in function in the oral cavity, so after the cutting process? First, it can be an inflammatory process caused by the terminal position of the wisdom teeth at the end of the tooth row. A second reason might be the presence of caries or tooth decay caused by a hindered oral hygiene, and finally, orthodontic problems caused by a shortage of space. The retention of wisdom teeth means that they can't reach their final position in the oral cavity because of, for example, their orientation in the bone with a retention after the last tooth in line. The surgical procedure for the extraction of a retained wisdom tooth is called osteotomy. First of all, we will see the surgical approach on the upper jaw. Normally, after the removal of the covering bone, the tooth can be removed unbrokenly. The surgical approach at the lower jaw differs because of the hardness of the covering bone, which is more hard than in the upper jaw. The first step is similar to the one in the upper jaw because we have first the removal of the covering bone. After that, we have a cutting of the tooth crown and the removal of the crown. The next step, the separation of the different root fragments and the removal of every single root part. So, what is now important to know about the first 7 days after the surgery? In the first 3 days, there will be a swelling with its maximum after the 3rd day after surgery. During that days, it's important to have a proper cooling and the intake of painkillers. After 4 days, the swelling will fade away, but a hematoma will be visible. After 7 days, the sutures will be removed, and after 10 days, the swelling and the hematoma should be disappeared. Prior to the surgical procedure, different types of Xray diagnostics are necessary to decide whether the wisdom teeth should be extracted or not. With a panoramic image, it is possible to assess the position of the wisdom tooth with regard to sensible structures like nerves or, in the upper jaw, the sinus cavity. If the position of the wisdom teeth is ambiguous with regard to neighboring sensible structures, then a 3D X-ray image, so-called cone beam computerized tomography, or a computed tomography can be performed to avoid any damage to neighboring structures. Thank you very much for your kind attention.